That's your heads up that we're recording. Welcome everyone to another Tuesday morning open learning session with the Community Ambassadors Network. I'm joined by my colleague Lydia Joy. I'm Chief from the Health Commons Solutions Lab. Nice to see many familiar names and faces here. One of the questions that we keep hearing about both in the media and in conversation is around the issue of blood clots. This tends to be pretty focused on the AstraZeneca vaccine. So what we thought we would do today is just a little bit of a check-in with the ambassadors, with you all, to see what kind of questions you're hearing about AstraZeneca and get a sense of how, what we could do together to kind of figure out what messaging could work with our community members. So I'd love to kind of just check in. If you've had questions about AstraZeneca, if you could raise your hand and share what some of those are. You're hearing that as a recurring theme. Would like to hear what that's been like for you out in the field or out talking in the community.
Most community wait Moderna or Pfizer because of blood clots. They heard that, and now it's hard to backtrust people. It's not, blood clots is very rarely, but they don't believe.
Okay, thanks, Ivana. So it's that idea that they're hearing enough in the news that it's making them nervous about AstraZeneca. Anyone else finding that there's the preference or a choice for other options versus AstraZeneca? Is that a recurring theme for people in the community? You can use the hand reaction function if you'd like.
Yeah, it's definitely a recurring theme in the community. I think it was either last week or the week before that the news came out that a woman in Australia had died, and the doctors were only tracing it back to the AstraZeneca vaccine that she just received. So there is also that story kind of popping up a lot, and even pointing out that it is one person out of millions doesn't tend to help.
Hello, everyone. Actually, that woman was Ukrainian, and her parents live here in Toronto, and I had a chance to speak with her mother. So actually, they really upset about that, and they think that it's because of AstraZeneca. And right now, all Ukrainian community starts to discuss that, and it's a big problem.
Thanks for sharing that, Lesia. And I'm sorry to hear that this is so close to home for someone that you've been in touch with, and lots of condolence there. And it's really, really unfortunate to hear this. Obviously, we don't know the circumstances and the specifics of this particular incident, but thank you for sharing that. Vanessa, is that enough for you to kind of riff off of?
Yeah, for sure. And you know what, like I just have a little bit of information to provide, and then I think we can jump into question and answer. Samantha, I saw that you unmuted. Did you have a question that you wanted, or a comment that you wanted to share before we get started?
Okay.
No? Okay, cool. I know it's always so hard on Zoom. Okay, so I'm going to do my best to share just a couple of slides. Okay, are you, you're seeing my slides?
Yes, we can see you get the slides, Vanessa.
Okay, perfect. I'm so sorry. Okay, so yeah, it's so challenging to communicate some of these things, and especially when there is information that's coming out and changing day by day, week by week, and also to I think one of the things that is very interesting about this time is that we are just seeing science play out on the media. But this is the way that science always happens, is that, there's evidence that emerges, there's guidelines that are modified, there are new cases, we study those cases, we pivot, and what's happening is this has got like the limelight, but unfortunately, the way that sometimes it's portrayed is it can overemphasize some things and underappreciate other aspects. And I think it's all in the context of, we all know that bad news travels fast. And so it can be hard to contextualize when there is a risk. Well, what does this risk mean versus the risk of something else, or the gravity of something else? So let's take a look at this. And I have to say, I'm going to say numbers here, and then you may go to an article and hear different numbers. And tomorrow you may hear different numbers. And so these are loose numbers because the data continues to emerge. So I'm just giving you, think of this as more of a sense of scale than precise numbers. So, okay, so AstraZeneca, there is a very rare, very, very, very rare association of the AstraZeneca vaccine and the development of blood clots. Looking at different studies, that risk ranges somewhere between 1 in 100,000 to about 1 in a million. And that risk really depends on, like, most importantly with age, but can also be based on different factors. In Canada, based on the evidence right now, we've seen about a rate of about 1 in 250,000. Now, other countries might be reporting a rate that's different. I think, I was just looking at something that was 6 in a million, and you're going to hear different numbers coming out, and that depends on a number of things. One, which age groups are getting the AstraZeneca vaccine, and then among those age groups, what is their risk of developing a clot that could be attributed to AstraZeneca versus developing a clot that's not attributed to AstraZeneca. So I think my main point here is you're going to hear lots of numbers, but the main point is that the association, the risk is very, 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 very low. And this is balanced against what's the risk of developing clots with COVID infection. And that risk is much higher. And it ranges from, and again, you're going to see different numbers, somewhere between 1 in 10 to 8 in 10. Now, that higher range, that higher risk of developing a clot is when you're very sick and you're in the ICU because of COVID. And that lower risk is, when you don't have as severe illness. Okay, so so that's one thing. That's the kind of direct comparison is, what's your risk of getting a clot from the AstraZeneca vaccine, but also what's your risk of getting a clot from COVID because you don't get a vaccine, but also what's your risk of becoming really sick and having other complications, not just clots, but all of the other things if you get sick from COVID. And I think that's one of the most important things to highlight. So the other thing is that, there are, and this is a really hard thing to communicate, and it's a really hard thing for us to think about, is that there are risks with everything that we do. When I rode my bike to work this morning, I took a really big risk of getting hit. And it's a risk that I kind of think about, but I don't really think about because it's like part of my daily routine. If you've ever got on an airplane, if you've ever taken a Tylenol for a headache, if you've ever walked across the street, like every single thing of these things that we do does carry a risk. And we're constantly kind of subconsciously balancing risks in our minds. And so, I've put up the risk, for example, of having blood clots with the birth control pill, which is a risk that women around the world take on a daily basis. That risk is about 1 in 10,000. Now, importantly, actually, we're talking about 2 different types of clots, but it's just, while we're talking about clots, let's make a comparison, okay? There's also a risk of clot when you get on an airplane, when you go for a long, long drive. Again, different types of clot, different mechanisms for developing the clot, but I'm just kind of putting it into that context. Now, okay, what are these clots? It's a different mechanism than the types of clots that develop when you don't move for a long time after a surgery or on an airplane, or the types of clots that develop during pregnancy or when you're on the birth control pill. It's a different mechanism. There's a fancy word, and I don't think you need to, this is just of interest, vaccine induced immune thrombocytopenia. VIT is the acronym, okay? I think the main point is to know that it's a different mechanism that is related to the vaccine of how this rare event occurs. And why that's important to know is that if somebody has had a clot from something else, or they've had a clot in their life, it doesn't actually mean that they are at increased risk of getting a clot from AstraZeneca, because again, it's that different mechanism. So some people may say, well, I had a blood clot in my leg, 10 years ago. Is it safe for me to get the AstraZeneca vaccine? And we would say, yeah, it's safe for you to get it, especially if you're at high risk for getting COVID. So here's another thing that is to put this into context. It's really about and where I say that this is complicated, it really is, because you got to look at and kind of think about, okay, what's my risk based on my age of getting a clot, but also what's my risk based on my age and based on my risk of getting COVID, of getting really sick from COVID. Okay, so it's, you have to look at what's my risk of getting COVID and what's my risk of getting really sick from COVID, and then what's my risk of getting a clot from the vaccine. So I'm going to show you a couple of different diagrams. You might have even seen these already on social media. So what this is looking at is we're looking at potential benefits versus potential harm. So the potential benefit, we're going to say, preventing you from being in the intensive care unit, preventing you from being hospitalized in the ICU if you get the vaccine. Okay, that's what's over here. And then, what's the risk of developing a clot from the vaccine? So here's if you have low exposure risk of COVID. When you're younger, you're less likely to get sick from it if you have a low chance of actually getting COVID. So let's say you're living in a cabin in the Yukon and you're not coming into contact with anyone, and you're 30, you might say, well, you know what, my risk of getting COVID is really, really low. So, balancing against this risk of getting the shot, I'll just wait because I have like zero chance of getting, I'm talking like you're not leaving your cabin. Like you're not coming into contact with COVID. That's a particular circumstance. But the reality is we're not at low risk in Toronto anymore. We're at medium exposure or even high exposure, right? So when we think about your risk of exposure to COVID is high, it means you have a high chance of getting COVID and getting very sick from COVID. So now when you look at the benefits of getting the vaccine, it far outweighs the risk of getting a clot, right? And what you'll see is that, of course, it's still people who are older who are more likely to get sick from COVID, but young people are getting sick. Young people are being hospitalized. Young people are being intubated in the ICU. And tragically, young people are dying from COVID. And so it's really thinking about that risk. And it's not to scare people, but it's really to say, okay, well, what's the risk of getting the vaccine? Very, very low. But what's the risk of not getting the vaccine and the potential of getting COVID and getting very, very sick from COVID? And I think that's like the situation we're in Toronto. So I'm sorry, I know this is complicated, but I just want to kind of contextualize like why you might be hearing different numbers and how you can, some tools for trying to explain this to people. That right now you are at high risk of getting sick from COVID, or getting COVID and getting very sick from COVID. And that's balanced against a very, very, very low risk of getting a blood clot. So people also ask, well, okay, how would I even know if I do have a clot? So the symptoms of a clot are not subtle. They're quite obvious. So the clot, if it happens in the brain, it would be an extremely bad headache, like not a usual I'm tired kind of headache. Sometimes having blurry vision or double vision, having like weakness on one side of your face or one side of your body. Or, if it's clot in your lungs, having difficulty breathing, having severe chest pain. Most of the time, it's almost, all of the cases, if it's going to happen through this special vaccine-induced mechanism, it will happen within 4 to 28 days after getting the vaccine. So it's people kind of want to know, well, when am I going to be in the clear? You could say, after 28 days, you can kind of stop worrying, but also your level of worry doesn't have to be that high at any point in terms of receiving the vaccine, because that is such a low risk. So, I think with that, those were kind of the main points that in terms of the questions that I've been receiving, and I think the things that are important to communicate, but I would love to open it up at this point for questions and clarifications. And please ask any questions. This is complicated. It's really complicated to be able to say, oh, okay, well, your risk for you is like this. And so it's kind of, I want you to understand some of that nuance, but I think we can also talk about how to communicate this, because you're not necessarily going to show these graphs, but how to communicate this in an understandable way. And we can provide you with some talking points on that, but I think it's helpful. I think some of you already know me a little bit, and I like to know why. Like, since I was 4 years old, I was one of those why kids. And I think many of us are. And so I want you to be able to know for yourselves why, but also if people ask you questions, that you've got a little bit of background to say, well, this is why. And
So Vanessa, we've got a first raised hand from my colleague Noor, and a question in the chat. So maybe we'll go Noor first, and then we can do the chat question next.
Hi, Vanessa. Thank you so much for coming. I have 2 questions. The first being, let's say I do develop a clot, or like someone I care about develops a clot. What happens next? How do we, is it treatable? Is it life-threatening? What happens? And then the second one, let's say someone doesn't know about the symptoms of a blood clot and they develop chest pain. Like, what would make them think that this is a blood clot and not like a symptom of COVID?
Yeah, such a great question. So, in terms of the first part of your question, what do I do? You go to if you have a severe, like any time in your life, if you have a severe, unusual headache, blurry vision, like, again, this is not your migraine headache. It's not your, I didn't sleep headache. It is a severe, unusual headache that's not going away, or, chest pain and can't breathe. You go to the emergency department. You just go. And I think that's, and then what they will do is they will be able to identify, they will quickly do the scans that are needed, the blood tests that are needed to determine, well, is this chest pain a clot, or is this chest pain, a heart attack, or is this chest pain something else? Okay. And then there is treatment that is available for these clots. So you want to access that care right away. Now, no treatment is 100%. That's important to know. So delays in care can lead to fatalities. I want to be clear about that. But it's important to know, if you have concerns, you seek immediate medical care, that there is treatment that's available. And then to your other great question, like, well, what if I'm having chest pain and I don't know, is this COVID? Is this the vaccine? Is this something else? I think and again, it's hard to communicate, but like a little twinge where you press on your chest and it hurts, like, that's not the chest pain that we're talking about, right? That's probably a muscle pain. But it's hard. Once you start worrying about these things, it's like, oh my God, I had an itch on my nose. Like, could this be, we all go to that place, right? Once we're worrying about something, we experience our body in different ways. So it's kind of balancing, like, these are significant symptoms. So if you're having significant chest pain that's not going away, if you're having difficulty breathing, not going away, like you go seek medical care, and they're going to help you to figure out what this is. And if you have doubts, you know, if you think, okay, I'm having a little bit of pain, I don't really think I need to go to the emergency department for this, but what you do is you call your primary care provider, like your family doc or nurse practitioner or another healthcare provider that you can get in touch with to ask, you know, I'm not sure what to do. And they're going to help you to say, hey, come on in and see me, or you need to go to the emergency department. So I would just encourage people to say, if you have a question, seek, you know, kind of the appropriate level of medical care. Now, what I don't want is for everyone who gets a little bit of a headache after the vaccine to go to the emergency department, because that's not good for our system. And that actually exposes people to COVID. So I'm so sorry. It's like this nuanced thing of like a little bit of headache, you take a Tylenol, it goes away, you're good. Okay. Like excruciating headache for a full day, you can't see, Tylenol, ibuprofen, nothing's hitting it, you go to the emergency department. And if you have a doubt, you call somebody.
Thank you so much.
Great questions.
So we've got a couple questions now in the chat. The first question, are blood clots in the lungs and brain the most common with vaccines? And I don't know if Cynthia, if you want to add anything else to that, but that blood clots in the lungs and brain most common with vaccines.
So yeah, I mean, well, these are the types of clots that we worry about. Like these are the ones that cause damage. So if you've got, and these are the ones that we're kind of seeing these reports on, again, exceedingly rare events, but they're serious events, which is why we care about them. Yeah. I mean, blood clots can happen elsewhere, but if it's in your leg and it doesn't travel to your lungs, then it's not, that's very treatable. But again, these vaccine induced immune thrombocytopenic VIT clots are a little bit different. And yes, so we're seeing them brain, lungs, and those are the ones that we worry about.
I see another one, and then Vishal, right? We're seeing she. Yeah. The other question was, why are there a higher risk of blood clots from AstraZeneca in younger people? Just out of curiosity, like, is there a reason why we're seeing the trend in younger people more?
Yeah, so it was such a great question. So one of the ways to contextualize this is, as you get older, your risk of just having a clot increases. Just like, you know, if you're 80 years old, you're just more likely to spontaneously get a blood clot compared to if you are 20 years old and active. And so some of it is really trying to say, what's your increased risk of getting a clot with the vaccine compared to not? So when you're 80 years old, like when they looked at, okay, how many people, 60s, 70s, 80s, when they looked at those groups, it's like, well, actually, yeah, some of those people are getting a clot, but it's not different than their natural risk of getting a clot at that age, versus when you're younger and you don't kind of have it still can happen, but you don't really have that baseline risk. So that's one reason, and that's one reason why, you know, initially, we didn't see the vaccines being approved in these younger age groups. Then the second thing is just, it's related to this very specific, like, immune mediated response that actually causes the clot.
Thanks. So the next question we have in the chat, and then we'll go to the two raised hands. Does the AstraZeneca vaccine make you immune from getting COVID?
So yes, well, okay, nothing is 100%. None of these vaccines are 100%, but the AstraZeneca vaccine as with the Pfizer vaccine, as with the Moderna vaccine, as with the Johnson & Johnson, they're all effective in protecting you from getting sick from COVID. And most importantly, they are very effective in preventing you from getting sick, from getting severely sick from COVID, from getting hospitalized, severe disease, ICU, or death. And those are the things that we care about the most. Again, the important thing is if it is a 2-dose vaccine regimen, so Pfizer, Moderna, and AstraZeneca, all of those, you need 2 doses. It's getting the 2 doses that provides you with that high level of immune protection. But even the first dose gets you some of that immune protection. And I say that because even if you've got 1 dose, and even if you've got 2 doses, you still need to mask, social distance, follow all of the public health measures that we've been practicing all year. Should we go to one of the people with their hands up?
Yeah, we have Vishal. I just wanted to ask one quick clarification. I know you had mentioned at the beginning, like when we're seeing symptoms that some people will like if it's minor, just take a Tylenol, etc. I know part of the conversation has been like what over-the-counter painkillers are okay. There's some that have recommended like not to take an aspirin or take something that suppresses the immune system. Are there any recommendations around that, like how you're able to use over-the-counter to deal with some of the symptoms that you've said that are normal or minor after taking a vaccine?
Yes, great question. So recommend taking acetaminophen, which is Tylenol, and it's like paracetamol. Sometimes people, that terminology resonates a bit more. So that's great. Or taking ibuprofen, so that's like Advil. What I tell people is take whatever you normally take for like a headache or for achy muscles or for a fever. And the reason that I say it that way is I don't want to blanket and say, oh, just, you could take Tylenol or Advil, because there are some people who shouldn't take Advil, ibuprofen, because of their own medical conditions. So I kind of say, like these things, but whatever you normally are allowed to take for, a headache, for a fever. Yeah, great question. And actually, maybe Lydia Joy, I wonder if there's a part of your question that's linked to, there have things been floating around. Oh, okay, take an Advil or an ibuprofen or an aspirin before you get the vaccine, because that's going to protect you against the clot. And we haven't found any association that is going to be protective. So no need to do that.
Thanks. I think Vishal's been waiting pretty patiently, so we'll take Vishal, then Ritika, and then Jamal.
Hi, Vanessa. Thank you so much for taking the time out of your busy schedule to answer all our questions.
Oh, it's so great to have you here. Thanks for all the work you're doing.
No problem. Question that I received in the field was, after taking so it's a 2-pronged question. After taking the first vaccine, can I just go out willy-nilly and do I need to wear a mask, or can I still interact with close people in my close bubble? Number 1. And number 2, how effective are these for individuals with underlying conditions, any of these vaccines? Thank you.
How effective did you say? Are they for people with underlying conditions?
Correct.
Yeah, okay. So you see me being like a big sister no phase. I flipped out at my parents because they got their first dose of the vaccine and then they wanted to see their grandkids. And I was like, no. What I tell people is you still have to pretend that you didn't get a vaccine. Like nothing has changed in your behavior and in the precautions that you need to take. Like in your heart, you can know that you've got some really important protection, but the masking, the distancing, the like staying at home, the washing the hands, all of that is the same. So then people might say, well, why the heck get the vaccine then if I still have to do all this stuff? Like I want to do this because I want to hug people. I want to see my family. And the reason is you just have to say, we've got to, we're getting there, but we're not there yet. What we need is for, everyone to get their 2 doses or their full dose. And with the Johnson & Johnson, it's going to be 1, but their full doses of the vaccine so that we have transmission of COVID and just the level of COVID in our communities come down. And at that point, when there isn't COVID spreading around and when people have that protection for themselves, but also potentially protection of spreading it to others, that's when we move towards a point where we can take off our masks, where we can hug people, but we're not there yet. And we can't, this is not the time for us to give up on that. And I know, again, that's like a really hard thing to communicate, but it's think about it as delayed gratification. And it's this like a collective delayed gratification, and we're all relying on one another. Like you know, in the beginning we were saying like your mask protects me. And in the same way, it's like you getting vaccinated protects me and everyone else. Like we have this responsibility to one another. And I actually think that that's sometimes an important thing to leverage is like, you know, you're doing this for yourself, but you're also doing it for your family and for your community. And this is like a collective responsibility that we're all engaging in. Yeah. And then, okay, for the second question, is it effective for people with underlying health conditions? So the answer is like mostly yes, but it depends. Of course, there's no simple answer in any of these things. So to be very clear, like the studies involved people that have diabetes, high blood pressure, heart disease, anemia, asthma, like lots of those conditions. And it is safe and effective. Okay. And you really want those people, especially with like heart disease, to get the vaccine because they're at high risk for becoming very sick and dying. So that's one. The conditions where it is a little bit trickier is if you have a condition or you're taking a medication that weakens your immune system. So it's safe for you to get the vaccine. It's just that is your weakened immune system going to build up its antibodies and T cells and its like fighter response so that you can fight off the virus if you encounter it? So we still want those folks to get the vaccine to protect them because they're at high risk for becoming very sick. But kind of depending on like what is the level of their immune system at a given time, that may affect what type of immune response they're able to mount. So, but I would still say if you can get like a 20% immune response, that's better than zero. The other thing is, and again, this is this collective responsibility that we have. That's why it's even more important for me to get the vaccine so that I protect other people who either, you know, can't get the vaccine for some reason, which is exceedingly rare, or that they don't develop a robust immune response to the vaccine. So what does that immunosuppressive like condition or immunosuppressive medication mean? It's where it's something where somebody has cancer and they are actively receiving chemotherapy, right? And chemotherapy, what it does is it bottoms out your immune system so that your body stops attacking itself. So in those circumstances, we still want those people to get their vaccine, but what we would say is get it as close as possible to like wait for as long as you can from the chemotherapy session that you had so that your immune system is coming up, you get the vaccine, your immune system is as strong as it can be, it builds up its response, and then you get your next chemotherapy session and it goes down. So I'm sorry, I'm probably getting into more detail, but it's a really good question that you're asking, and I just want to give that sense. So the take-home message is safe and effective. If you are in this specific circumstance of a condition where you have an immunosuppressive condition or medication, something that weakens your immune system, or an autoimmune condition like multiple sclerosis, those are circumstances where we want you to talk to your healthcare provider to determine the timing of getting the vaccine so that we can make sure that it's most effective for you. But all the other conditions, diabetes, heart disease, blood pressure, anemia, arthritis, all of those other things, go for it, get it as soon as you can.
Got it. Perfect. Thank you so much, Vanessa.
Thank you.
Great questions, Vishal. Thank you. I'm going to ask Ritika to go next.
Thank you. And thank you, Dr. Vanessa. Honestly, I wanted to just say a big thanks for the presentation. And I really hope if we can, I don't know, get it somehow, because I really do feel, and I mean, against vaccine hesitancy or misinformation, numbers are what actually matter. And they're really good ones. I think that's what brings me to my question is like when we started, when you were discussing and introducing clots, you discussed that aside the vaccine, that they do have various other causes. And I mean, the ones that I could think of were like birth control or tampons for that matter. But as a part of the conversation, when people do discuss about being afraid of clots from the vaccine, it's also important to kind of let them know that there are other causes which are also there. Like vaccines are not the only ones that end up giving you clots. So I guess I just wanted to know, like, what are the other causes that you wanted to talk about? Maybe we should kind of put that out there so that people don't just blame the vaccines for it. You know what I'm saying?
Yeah. So, you know, I think that's a great question. And I'm going to give, again, I'm going to give a little bit of a complicated answer to it.
That's
and
okay.
The only reason that I'm saying this is I think we can talk about like other causes and risks of clots, but I just want to distinguish that the way that the causes of those clots, it's just a different like bodily mechanism than the bodily mechanism for these vaccine related clots. And the reason that that's important is we don't want to confuse, well, one, we just always want to be accurate in what we're saying. Otherwise we end up eroding trust and discrediting ourselves. That's one. Number two, it's helpful also then for somebody to be reassured of like, well, if I've had a clot before in my leg, I don't think I should get this vaccine. And we can say, no, it's like, I understand your worry and your concern. The good news is that this is a different mechanism for developing a clot, and that risk that you had, you know, during pregnancy of developing a clot is different than this risk, and it doesn't put you at increased risk. At either a personal or a family history of having those types of clots doesn't put you at an increased risk for developing this vaccine-related clot. So I think your question about, well, what are the things that can cause a clot? So a few things, and I'm going to start with really common things. Anyone who's been pregnant has had a high risk of developing a clot during your pregnancy and after you deliver, okay? It's actually a higher risk than with the birth control pill. And that's it, the mechanism is because of estrogen. It increases risk of clotting. Okay, birth control pill, something again that women all around the world take on a daily basis, has a risk of developing a clot in your leg that can go to your lungs, a clot in your heart, a clot in your brain. It carries those risks. Being on an airplane or going for a long bus ride, car ride, something where you are not moving your leg for a while can also increase it comes with a risk of developing a clot. Similarly, after you have a surgery, and part of it is just, you know, your body healing from that surgery, but more importantly, like lying in a bed for a long time increases your risk of clot. Anything where you're not moving your body, like just lying in a bed, not walking around, not using those leg muscles, increases your risk of clot. When you have cancer, it comes with a very, very high risk of clots. So, you know, I think that these are things that we commonly do, and they have a higher risk of clot than with the vaccine. The thing is, you know, there isn't a daily news story about the risk of getting a clot when you're pregnant.
That's true.
Yeah, but it's a much higher risk actually. So again, this is why this idea of risk is really, it's very interesting and tricky, because we deal with risks all the time, but we just don't necessarily think about them. We've just kind of said, oh yeah, like I'm willing to take on this risk.
That's perfect.
Yeah.
Okay, see, that's why I wanted to ask you just the common things, because like you said, they're common, but just people don't associate that as a risk. versus a vaccine-related clot? Okay,
Yeah,
thank you so much.
Excellent question, Rithika. Thank you.
Thank you.
So we'll go to Jamal next, and then there's a couple more in the chat. So.
Hi.
Jamal, Dr. Jamal. I was like, I have to study because Dr. Jamal is going to come and ask me so many good questions.
Good morning. So I know there's a lot of like research that's coming in like every day. And this is pertaining to specifically like how exactly they're finding like that causative link between like AstraZeneca and the blood clots and stuff. I know that there is a condition it's like immune mediated, like hairpin-induced thrombocytopenia, and the way like they it's an anticoagulant for people who don't know, the way they kind of diagnose it or find that link is like with antibody assays and stuff like that. I was wondering if that's the same thing that's being done to find that link between the AstraZeneca vaccine and like the blood clots that are found in the reported cases.
Like I said last time, Dr. Jamal should be my co-presenter because you know so much about all of this. And so the answer is well, okay, my answer, and I'm no hematologist and I'm no immunologist, is yes. So you're right on the money. This vaccine-related clot that we're seeing with AstraZeneca is more similar to the mechanism of a heparin-related clot, which is kind of this immune-mediated, like having low platelets, and then you have this like effect where then you bump up and you actually develop a clot. So it's complicated, but all that to say, it's more in that category of things that happens versus the mechanisms that we have that are like the pregnancy and estrogen related clots and the like immobilization, I've been on a plane for 12 hours or in a truck for 12 hours type of clot, or the cancer related clot. Like those are different mechanisms. And so, yeah, I guess to answer your question about how we're tracking this, one thing is that whenever there is an adverse effect from a medication or vaccine, like kind of as the healthcare provider, you're obliged to report it to a national monitoring agency. And we're probably way more on the ball with this, with the COVID vaccines than we would be with other things. And so when this happens, we need to report it. And then that's how they're tracking the number of cases and really going into, well, you know, was this actually just a pregnancy clot or was it this type of clot? So I think the evidence is emerging. And I think that's where, you know, you might be seeing different numbers and things are kind of changing. And it's kind of like, okay, we're seeing something. So what happens is once there's a kind of an increased risk of something going on, it becomes a flag for, you know, the Health Agency of Canada and scientists. And then they start to look into that, you know, they call it like a signal in kind of the monitoring. And then they start looking into it and figuring out, well, what's actually going on? Because sometimes the signal is nothing, it's just noise. And sometimes the signal actually means something. And that's why we're doing this research. So excellent question. I hope I kind of answered it.
Yeah, you did, thank you.
You may have nerded out a bit too hard, and I don't know that I fully followed all of that, but I appreciate the very smart question, Jamal. So the next question we have in the chat is a very quick one. I know that we've covered this in one of our presentations previously, but if you don't mind touching on it again, Vanessa, what's in the vaccine?
Okay, yeah, great question. So for AstraZeneca and Johnson & Johnson, you know what, I'm just gonna flip up my slides if that's okay. And I can send out a copy of these just so it's handy for you. Okay, so actually I'm gonna go to, so AstraZeneca viral vector vaccine. The medicinal ingredient is a modified adenovirus, a modified cold virus. Think about this as the delivery truck that is bringing the instructions for making that spike protein to your body, okay? That cold virus doesn't replicate itself. It doesn't make you sick. It's just a delivery truck, okay? So then it gives you, your body, that little like temporary instruction sheet to make the spike protein. And that's what triggers your immune system to make a response. The other ingredients are salts, acid stabilizers, emulsifiers, sugar, water. So in AstraZeneca, I'm just giving the fancy, this is like for Jamal and the other docs on the, and chemists and scientists and those people who are interested in the details. Here are the chemical names of those ingredients, but the broad categories of those non-medicinal ingredients are listed here. And it's similar for Johnson & Johnson. Okay, in the case of the mRNA vaccines, so this is talking about Moderna and Pfizer, the medicinal ingredient is the messenger RNA, mRNA, which is, again, just that temporary little instruction sheet to instruct your body how to make that spike protein. And then the non-medicinal ingredients are fats, salt, sugar, water. Sounds like cooking or baking without the flour. So, oops, these are just the chemical names for Pfizer and for Moderna. Okay. What's not in the vaccines, and I think this is just an important point, is there are no food products. So somebody says, well, you know, I have a peanut allergy. Is this going to be safe? You can say, yep, absolutely. Like there's no peanuts in the vaccine, so it's safe for you to get it. You know, if you're worried about having an allergic reaction, then just stay for 30 minutes after receiving the vaccine. We're going to monitor you. There are medical staff that are available that can help you if you do in that rare circumstance develop a reaction. And if you are going to have an allergic reaction, it will happen within 30 minutes. So we got you. Similarly, no antibiotics. So same response. Somebody says, well, I've got a penicillin allergy. Can I get this? You say, yep, no penicillin in the vaccine. There's no, the Marisol, formaldehyde, these were chemicals that were in like way, way, way old vaccines, not in these ones. There are no fetal cells, no microchips. I do want to just bring your attention just briefly to two vaccine ingredients that you're probably hearing about, and because they're on the consent form. So these are some of those non-medicinal ingredients that are part of the vaccine. So polyethylene glycol, PEG, is a chemical that is in the mRNA vaccines, Moderna and Pfizer. And it's just this like, kind of makes things smooth, let me say that. It is a very common substance. It's in laxatives. It's in bowel preps. Like if you've ever taken Restoralax, Laxaday, if you've had a colonoscopy, you've had a ton of PEG. It's in cosmetics and skin products. It's in the like gel coating of things like Advil liquid gels. Okay, so what I tell people is we're going to ask you this question. Are you allergic to PEG? And some people are like, I have no idea what polyethylene glycol is. Then I'm like, you don't have an allergy to it. It is exceedingly rare to have an allergy to PEG. And you will know it because you have encountered this in your life. Like if you've lived around, at some point you've come into contact with PEG, so you're going to know if you have an allergy to it. Similarly, so Polysorbate 80 is a chemical ingredient in the AstraZeneca and the Johnson & Johnson vaccine. And again, this is kind of something that like makes things kind of smooth. It's a common substance that is found in food products like ice cream. So it's not the dairy thing. If somebody says, oh, I have a dairy allergy, don't worry about it. That's fine, no dairy. It's this chemical that kind of makes things smooth. So ice cream, it's in gum, it's in a lot of cosmetic products, and it's also in other vaccines like the flu shot. So my point here is people may have been alerted to these two chemicals and said, do you have an allergy to them? And we're going to ask, but the answer, like I've never met anyone who has these allergies, and you will know if you have these allergies. I think that's kind of the take home point here. I hope that helped. That was probably longer than you needed.
Thanks, Lee. I know we only have 7 minutes left. I've got about a half dozen questions in the chat. There was a question about the screening questions that are asking about anaphylaxis. Do these allergies impact your eligibility? And the short answer is no. But do you want to elaborate a little bit there?
Yeah, so if people are worried about allergies, you say you can, as long as you don't have an allergy to PEG, polyethylene glycol, or Polysorbate or your first dose of the vaccine, then you're fine. You can get the vaccine safely. And what you do is just wait for 30 minutes in the waiting room rather than 15. Medical staff are there to help you in the rare, unusual circumstance that you have an allergic reaction. They're there with the EpiPens. Boom, you're good.
The rapid fire next question. What would your recommendation be for someone who's taken the Pfizer vaccine about 2 weeks ago, has been experiencing dizziness since, and this person is now looking for answers. They're unable to perform his daily, I don't know what an ADL is, and has refused to go to the emergency doctor as his personal doctor has recommended. So it seems like a bit of a tough situation here. But I don't know if Daveen wants to add anything else, but.
Yeah, I mean, it's hard for me to comment on an individual case in terms of, but I would say, you know, if this person has talked to their individual doctor, that you know, family doctor, whomever has recommended to go to the emergency department for additional investigation, then I would encourage that recommendation, especially if it's interfering with activities of daily living, ADLs, like that's a dizziness that's like, that's a pretty significant, it's not just kind of like, oh, I feel a bit tired. So I would recommend that person seek medical attention to be on the safe side. Yeah.
Thanks, Dr. Reddick. Okay, another great question. I've had a few conversations with people in the community who don't see the point of getting vaccinated because it's not 100% able to stop you from getting COVID, and you still have to follow all the guidelines afterwards. So for those people, how would you approach the conversation of getting vaccinated when they feel like it doesn't change much from what they're already doing? Social distance, only leaving the home, sanitizing, etc. So it's like, it's not changing your daily health practices, but it's, what else can you add to that to make sure that they say yes?
Yeah, you know, I think that this is a common concern. I'm trying to think of a good analogy, but I think, and maybe you figure out something with that person to say, like, what is something that you've done in life where you had to do something annoying now that helped you later on? Like maybe that's, you know, like how many times did you have to write some essays in order to get your you know, university degree? Or how many times did you have to, I don't know, there are many things that we do where the benefit is not immediate. And we have to engage in this behavior so that we get to that future point. And like, it is on, we're not there yet, but it is on the horizon. And we want to move towards that safety and that future normalcy. But if half of the people hold back, none of us get there. And this idea of like really it is community. I mean, this is a lesson in life of how we are interdependent and interconnected, not just in, you know, here, but around the world. And so what we want is for everyone to be able to get the vaccine because it protects one another. But it's just that we're not there yet. It's a little bit more time, but the sooner you get it, the sooner everyone gets it, the sooner we all get to that place. I think that's one. Number two is like, I'm hard pressed to think of anything in life that is certain and that is 100%. And I think it's important to remind people that like most things that we do are not 100% guaranteed. So, you know, they're actually all of the other vaccines that you take in life, the tetanus, the measles, the polio, that have saved lives, their actual effectiveness is lower than the COVID vaccines for many of those vaccines that we take. And so I think it's trying to communicate that. And again, I think it's important, you want to recognize, like, I hear you. We are tired of doing this stuff. I'm tired too. I want to hug people, like whatever it is, you want to build a relationship, validate, hear that concern, and then make a connection of like, what, you know, when I was vaccinating people and they were nervous about getting the vaccine, I said, tell me what you want to do after this all ends. And they say, oh, I want to hug people. I really want to go to a restaurant. I want to travel. I want to see friends. So ask them that. And then say, you know, the sooner we all get the vaccine, the sooner you get to that dream, that, you know, these things that we love.
Thanks. We're getting very close to the end, and I've got a couple of excellent questions. First one, is there anything you can do to prepare your body for the vaccine? And then the next question is like, why is AZ the one in the pharmacies versus Moderna and Pfizer and public health? Can you talk a little bit about that distribution and why can't we have all three at the pharmacy?
Yeah, so in terms of preparing yourself for the vaccine, for preparing yourself for a potential exposure from COVID, I would say, this is so important, just self-care. So trying to eat well, sleep well, exercise in a safe way, which is either, safely in your own home or safely outside where you're not in contact with others, and trying to do things that help to manage stress, because actually stress can reduce our immune system response. So those things are really, really important. You don't need to take any really special vitamins as long as you're getting a well-balanced nutrition, which has lots of vegetables and fruits. And I recognize that is a constraint in how our food systems work, unfortunately, but wherever you can get that nutritious food, that is one of the best things that you can do. So the second question about vaccine availability, the reason that AstraZeneca has been the one that has gone out to pharmacies is around its stability. It's a vaccine that can be in fridges. It has a longer shelf life. It doesn't matter as much if it gets shaken up. So it's just more stable as a product to be in these other places versus the Moderna and the Pfizer. They have to be kept at a cold temperature. They have to be handled in a very, you can't shake them. They have to be handled in a very specific way, which is why they're being utilized at hospital-based sites, these mass vaccine sites, because there's a whole team that handles them. Now, I think it's possible in the future, we're going to get better at handling vaccines and having these protocols in place so that the Pfizer and Moderna may actually move out to pharmacies and to primary care clinics and that sort of thing. But this is where we are now. So that's just the explanation.
Thanks. I think that's pretty much all the questions. There was a kind of follow-up comment from Daveen about this individual who didn't want to go to the emergency. I think a bit of concern from them that they might have to wait a while at the emergency and fearful about exposure to COVID in that instance. I want to thank everyone before we just close. Daveen, and maybe you and Dr. Reddick could just take a minute and we'll just formally close the session. We will see you again next Tuesday. For those of you, over the course of the week, feel free to use the Facebook page to pop questions in so that we know what kinds of things we want to chat about next Tuesday. Thank you, Dr. Reddick, so much for your time, your generosity, helping us with lots of the science. It's been, as always, really enlightening. So thank you again for doing that. Yeah, I'll pause the recording here. And then if you want to just, you and Daveen want to just take a moment to chat about that other piece, that might be useful for Daveen.